Well, you are finding this video on the right day, whatever day it is, because I am providing you some education on this fine day. And I am trying to reach two groups, of you in particular. And that is the patients and the clients that are struggling with mental health issues, as well as loved ones. So if you are a patient and maybe you're working with someone who's already taught you what I'm about to share, don't tune out. Please share this with somebody else. This is important stuff, and I want people to know how to handle a loved one or yourself when you're having serious symptoms. And so this is kind of how it goes. This is where the inspiration kind of came to me just in the last few days. When people are struggling with, let's say, a panic attack or suicidality, some of the more serious symptoms that go along with mental health, oftentimes those of us that are observing this, if we're not trained, we don't know what to do. And if we're spouse or if we are parents, because we know that person so well, you know where I'm going with this? Sometimes we start to speculate, oh, I wonder if they're trying to get attention. I wonder if this is attention-seeking behavior because they've seen a friend do this before, or they are upset that we got in an argument and they're trying to just smooth things or manipulate things over. I understand the dynamics involved in all of those things. Trust me, I really, really do. But I want to tell you, when we fall into that camp, here's two things that can really happen, and neither one is good. Number one, we start to shame them. And this happens with children, right? They might be mimicking behaviors that they are seeing at school from someone who is faking a panic attack because they want to get out of a test. Absolutely, that can happen. And then your child comes home and they're doing that when you're getting upset or, casting down a consequence. Same thing with suicidality. I mean, it happens with children, but also with adults. They're trying to essentially get out of something, a tough conversation or just a tough feeling, and they don't even know they're doing it. So we don't want to shame people, and we don't want to not take them seriously, because trust me on this. You do not want to be someone that does not take someone seriously and then something does happen where your friend, your loved one, or your child does make a serious attempt of self-harm in some way. So here's my caution and my advice to you. Take it seriously every time, because here's what happens, and it's awesome, and this is proven. I've done this for the last 16 years because this technique was taught to me when I was working inpatient for a behavioral health hospital. If you take them seriously every single time they are sharing this, what you are doing is you are behaviorally conditioning them that every time that X, fill in the blank, that behavior happens, whether it is a panic attack or it is a suicidal gesture or anything like that, you are telling them that every single time that they engage in that they exhibit that you are going to essentially pack the bags. Right? You're going to pack the bags and you're going to say, well, we're going to go to the hospital because I sure am not in a position to assess you. So let's get you in front of someone who can. And this works for all ages, because if you can do it without any sarcasm in your tone, then what they are hearing is that you are safe enough to hear what they're experiencing and you are going to get them the help that they need. Now, can this be a little bit on the exhausting side for you if you are thinking, well, every time this happens, I'm going to have to pack? Yes, I'm going to stop you right there. Have a bag packed already. This is what I did with my patients a lot when I first started as a therapist, and I was trying to build my practice, and a lot of people were referring to me, and they were giving me some really tough cases that some of them did fall into this, and I could tell that they did as a clinician. I would tell them every time that this comes up, because I care about you and I have to do what's right, we're going to talk about inpatient care. And strangely enough, in some cases, it sobered them up and they thought, well, I don't want to have this conversation again. I'm going to do what she's saying. I'm going to follow through. Now, I can tell where you might be also objecting to this, that you're thinking, what if they just, retracted and pulled in those emotions and thought, well, I don't want to do that, so I'm going to just act like everything's okay. Again, my reply to that would be, if you can talk your loved one, your child, whomever it is, your friend, into this idea of every time this happens, we're going to take it seriously. We're going to follow through with A, getting an assessment somewhere, or B, actually admitting into a hospital, which actually requires an assessment anyway, then you are showing them that this is what we follow, right? You're showing them that this is what we follow. And if they start to kind of retract, and at least in front of you, they're retracting and acting like, everything's okay, get them in front of someone who can tell the difference. Because we can. They act different in front of us, and we are trained to know what to look for, what to ask, what kind of conversations to bring up to see the continuity of what their story is. We'll pull you into those conversations sometimes. But I know I'm giving you a lot of information in a fairly short amount of time, but this is my Education Tuesday. I'm trying to do this every Tuesday to give you some piece of education, and it just so happened that I was inspired over the weekend with a situation that I overheard, and I just thought, people need to know this. They need to know how to handle these things. So again, if you're the patient, I want you to know that this is coming from an absolute deep, deep place of love for you and wanting you to get the help that you need, and to realize that your struggle absolutely is legitimate, and I take it seriously. I'm also trying to help those that may behaviorally be struggling and they don't know any other way to get their needs met other than to either act out or respond, from a really intense place. Either way, aren't we still talking about mental health symptoms? Yeah, we are. It hasn't changed anything. I just want to equip those of you that are on the caring end of this, the caregiver end of this, to know that there is definitely a proven, effective way to address this. And it's addressing it every time and addressing it consistently and letting them know ahead of time, this is what we're going to do for the sake of everyone's safety. If there is a serious mental illness being managed in this household, we're going to have a bag packed for you so that if anything ever happens, because even when you think it's not going to, it can, we're going to have that ready. It's like getting ready to go to the hospital if you're having a baby, right? You just know the time is probably going to come. And so we want to have everything ready. We don't have to think about things right in the midst of a crisis. So go forth, use this information and education, and share it with those that need it. Thank you for tuning in, and I will see you next time.